When you use BlueDop, there's a column of numbers: ABPI, mean perfusion pressure, vascular reserve, all these great numbers. While you're using BlueDop, you'll see the Doppler waveform. And as a vascular surgeon or an angiologist or a vascular expert, that Doppler waveform means a lot. We talk about the Doppler waveform as being either triphasic, biphasic, or monophasic. For our tissue viability nurses, our skincare nurses, podiatrists, that waveform may not mean much. And that's okay, because BlueDop, through a very specific mathematical algorithm, actually analyzes the shape of that waveform, because there's certain features of that waveform that tell us a lot about the healthiness of the tissue and how that tissue is receiving that blood flow. And it's one of the factors that go into the calculation of that vascular reserve.